So today we are here presenting a case of Mrs. Jyoti Priya, 32 years old, para 4, live 4 and 2 abortions, housewife, completed 12th standard, residing at Darbar Palayam, Chengam, belonging to lower middle class according to Kupusami scale.
குப்புசாமி முந்தினதுலேயும் எழுதியிருந்தாங்க, நேம் எல்லாம் கேப்ஸ், அப்புறம் உங்கள் பேரையும் எல்லாரும் சின்னதில் எழுத ஆரம்பிச்சிடுவாங்க. சரியா?
Came to the OPD with the complaints of pain during menstruation for the past 3 months and mass abdomen for the past 3 months. And history of presenting illness. The patient was apparently normal 3 months back. Later she developed pain during menstruation on right lower abdomen, which is gradual in onset, continuous in nature during menstruation, dull aching type and non-radiating. Aggravated on 4th and 5th day of menstruation and relieved on taking medications. And mass abdomen for the past.
What medication did she take?
She was not sure that the name of the medication.
எல்லா பேஷண்ட்டும் இப்போ சொல்லும்பா, கூகுள் டாக்டர் சொல்லி தருவாருங்க உங்களுக்கு. கேட்டியா? ஓகே.
Mass abdomen for the past 3 months, which is gradual in onset and progressive in nature, no aggravating and relieving factors. Mass does not vary with cough, posture and straining. Mass not associated with pain.
What is the significance of mass does not vary with cough, posture and straining?
Ma'am, hernia. Hernia, ma'am.
Hernia, then? So it is mass, okay.
And she has a regular cycles with normal menstrual flow and flow lasting for 4 to 5 days, associated with pain abdomen with onset of menstruation, changes 3 to 4 pads per day, not associated with clots.
So what does this tell you?
Ma'am, she doesn't have any abnormal bleeding.
She has normal menstrual flow, only it is late onset spasmodic dysmenorrhea. What is dysmenorrhea?
Pain during menstruation.
Pain during menses. What is spasmodic dysmenorrhea?
It occurs before the onset of menstruation.
It occurs with the onset of menses or just a few hours, not days like that, and then usually lasts for 1 to 2 days. But this patient, this pain abdomen lasts for 4 to 5 days too. Okay. What is triple dysmenorrhea?
Ma'am, pain before menstruation, during menstruation and after menstruation.
Where do you get it?
Endometriosis.
Okay. So what do you mean by endometriosis?
Presence of endometrium outside the other than uterus.
So outside the uterine cavity. So it can be adenomyosis or it can be endometriosis externa, where you can have it in the ovaries, peritoneum, anywhere it can, rectum, okay, anywhere it can be there. Okay.
Ma'am, no history of discharge PV, no history of postcoital.
What does discharge per vagina tell you?
Ma'am, in case of infections, discharge will be there, ma'am. And in case of a submucosal polyp, if it is infected, then it will present as a purulent discharge, ma'am.
Okay, good.
No history of postcoital pain, ma'am. It suggests that no local cervical erosions or no cervical carcinoma, ma'am.
Or a fibroid polyp. Okay, fibroid polyp, that also when they have coitus, they can cause postcoital pain, postcoital bleeding per vagina.
And no history of fever, no history of intermenstrual bleeding, no history of difficulty in micturition, no history of constipation, no history of pedal edema, no history of loss of appetite, no history of weight loss, and no history of intake of OCPs, and no history of insertion of IUDs. Menstrual history. She attained menarche at 12 years of age. A 5/28 days regular cycle, changes 3 to 4 pads per day, which is completely soaked, not associated with clots, and her last menstrual period was Feb 18th, 2025, and no history of menstrual disturbances in the past. And obstetric history, married at 18 years of age, 14 years back. Her obstetric score was para 4, live 4 and abortion 2. And first consumption, which was a full-term institutional normal vaginal delivery, she delivered a girl baby 13 years ago. Second consumption, full-term institutional normal vaginal delivery, girl baby 12 years ago. And her third consumption at 68 days of amenorrhea, she done MTP by medical method 11 years ago.
What is it called?
Termination of pregnancy.
See, medical termination of pregnancy can be medical, can be surgical. This is called as MTOP, MTOP. Okay. So, medical termination of pregnancy. So, with drugs, with medicines. Suppose surgery is done. It is still an MTP. It is called as STOP, surgical termination of pregnancy. What are the drugs used in medical termination of pregnancy?
Misoprostol, mifepristone, ma'am.
Mifepristone. Okay. Today, go and read up about in WHO website. You can see. Medical management, MTOP, medical management of termination of pregnancy. For first trimester, how it is done. Second trimester, how is it done? And what are surgical measures? STOP also. It can be a DNC. It can be a DNE. Okay. It can be an IAS, intra-amniotic saline. It can be an extra-amniotic saline or extra-amniotic ethacridine lactate. Contraception, நிச்சயம் ஒரு question வரும்பா. தியரிக்கு ஒரு question வரும். Afternoon contraception question 5 marks கேட்பாங்க. So, தயவு செய்து அதை read பண்ணிட்டீங்கன்னா it will be easier for you.
Fourth consumption at 45 days of amenorrhea, she done MTP by medical method 10 years ago. And fifth consumption, full-term institutional normal vaginal delivery, girl baby 7 years ago. And sixth consumption, full-term institutional normal vaginal delivery, delivered a boy baby 3 years ago. No history of contraceptive used and sterilization not done.
So, very bad follow-up by the public health department. 4 children and 2 MTPs. Okay. We should have seen, she need not be sterilized, but she should follow some method of contraception. So, you should realize that our work does not finish with delivering babies. It follows later also for her good health and for the health of the baby. Okay.
And past history, she had a history of open surgery, left ovarian cystectomy 11 years ago, followed by hospitalization for 5 days.
So, you can say she had a laparotomy, open, okay.
And no history of diabetes, hypertension, epilepsy, tuberculosis, asthma, thyroid disorders, and no history of blood transfusion or no history of any chronic drug intake. And family history, no history of similar complaints in the family, no history of any bleeding disorders. And personal history.
What is the significance of all these things? Similar complaints na anartham.
Her siblings or her mother, they have normal menstrual cycle without any.
So, ovarian tumor can run in families. Fibroids can run in families. Okay. Nulliparous prolapse can run in family, not other prolapse. Okay. So, all these things very, very important. Adenomyosis can run in families. Okay. Bleeding disorders, when they have heavy menstrual bleeding, that can be due to bleeding diathesis.
And personal history, consumes mixed type of diet, normal appetite, normal sleep-wake cycle, no disturbance in bowel and bladder movements, and no history of smoking or any alcohol consumption.
General examination. The patient was conscious.
The patient is conscious. Purida.
Patient is conscious, oriented and cooperative. She is well built and nourished, normal gait, no pallor, no icterus, clubbing cyanosis, no lymphadenopathy, no pedal edema. Her weight was 93 kilogram and her height was 147 centimeter. BMI 43.03 kg per meter square. She belongs to obesity class 3. On examination of breast, thyroid and spine appears to be normal.
Morbidly obese.
Vitals, temperature afebrile. Her BP was 120/70 mmHg in a left arm on sitting position. Her pulse 76 beats per minute, regular rhythm, normal volume with no radiofemoral delay. Respiratory rate 16 breaths per minute. It is thoracoabdominal type. Systemic examination, abdomen. Inspection, lower abdomen was distended, umbilicus slightly deviated towards left. All quadrants move equally on respiration. No scars, dilated veins, no sinuses, visible pulsation. Hernia orifice free. Palpation. Skin over the swelling is normal, no warmth, non-tender, firm mass of size corresponding to 20 weeks of gestation, which is mobile from side to side and felt in right lower abdomen from right iliac fossa to hypogastrium.
Iliac spelling enna? Iliac spelling என்னமா ஸ்ரீவர்ஷினி? ஸ்ரீகாந்த், உன் பேர் ஸ்ரீகாந்த் தானே? அப்பா யாராவது ஹெல்ப் பண்ணுங்கப்பா. ஹெல்ப்லைன் இப்போ மட்டும் வர மாட்டேங்குது. இவங்கள அப்படியே ஆற்றுல விட்டுட்டீங்கப்பா, நட்டாட்டில். அவங்களுக்குலாம் வந்துச்சு ஹெல்ப்லைன். ஓகே, ILIAC. யூ ஷுட் நாட் மேக் அ மிஸ்டேக். நாங்கள்லாம் நீங்கள் கொஞ்சம் பார்த்து பொறுமையாக பார்க்கணும். ஓகே.
Upper border palpable, lateral edges are smooth, lower border not palpable, surface was smooth. On percussion, dull note heard over the mass. On auscultation, normal bowel sounds heard. CVS examination, S1, S2 heard, no murmurs. Respiratory system, no vesicular breath sounds, no added sounds. Summary, Mrs. Jyoti Priya, 32 years old, not sterilized, with complaints of pain abdomen and mass abdomen for past 3 months. On examination, vitals are stable, respiratory and cardiovascular systems are within normal limits. Abdominal examination reveals a mass arising from pelvis of 20 weeks of size. Differential diagnosis.
So you do not want to give a diagnosis. You want to give only a differential diagnosis. Okay. And you will speak only into the mic.
Okay. Fibroid, ovarian mass.
Fibroid edula? Fibroid uterus.
Ovarian mass, adenomyosis and pregnancy.
How did you think about pregnancy?
Mass size corresponds to 20 weeks of gestation, ma'am. So
okay.
Not sterilized.
Not sterilized. Then even if sterilized, will you not consider pregnancy?
Yes, no.
Still she can become pregnant. Failure of sterilization can be there even if we follow standards of sterilization. 1%. Okay. So always in a reproductive age group woman, you have to always think about pregnancy. Here her periods are regular, but still patient can have monthly periods occasionally even while pregnant in some. Okay.
Provisional diagnosis, a 30-year-old multiparous, not sterilized, with a pain abdomen and mass abdomen, probably a case of fibroid uterus without any comorbidities, came for institutional evaluation and management.
இப்போ மார்பிட் ஒபிசிட்டி இவளை கண்டா எனக்கு பயமாக இருக்குது. ஆப்ரேட் பண்ணி ஒழுங்காக இன்ஃபெக்ஷன் வராமல். மார்பிட் ஒபிசிட்டி வந்து உனக்கு கோமார்பிடிட்டியாக தெரியலையா? இட்ஸ் இம்பார்ட்டண்ட் பிகாஸ் நம்மளுக்கு அதுக்கேற்ற டேபிள் வேணும். ஷீ இஸ் குவைட் ஷார்ட், நாட் வெரி டால், 147. ஓகே. ஸோ இன்டுபேஷன் மைட் பி டிஃபிகல்ட். ஷிஃப்டிங் நம்மளுக்கு ஒழுங்கான இது இருக்கணும். லாட் ஆஃப் திங்ஸ். ஓகே. லாஜிஸ்டிக்ஸ் யூ ஹாவ் டு லுக் இன் டு they are more prone for problems. Post-op, we might have to institute certain treatment.
Management, investigations, complete blood count, hemoglobin, bleeding time, clotting time, ultrasound abdomen to assess the number, size and site of
நீ டிடி சொல்லிட்டு இப்போ நேரா ஃபைப்ராய்ட்ஸ் மட்டும்தான் பார்ப்பேங்கிற.
provisional diagnosis.
So ultrasound ultrasound abdomen to know what is the mass. Okay, and if it is fibroid mapping, and the word use பண்ணணும், can be done.
Pap smear, endometrial biopsy.
Grouping typing பண்ண மாட்டியா? தேவையா இல்லையா?
It's required.
Mandatory. Grouping typing பண்ணணும். And CBC நே போடுங்கப்பா. Complete blood count, hemoglobin வேணா எழுதிக்கோங்க. But won't you see the other, she has delivered so many times, ஒரு யூரியா கிரியேட்டினின், இதுக்கு எந்த இன்டர்வென்ஷனும் பண்ண போகிறது இல்லையா? பண்ண போகிறீங்களா இல்லையா? அப்போ வந்து ஒரு யூரியா கிரியேட்டினின், எஸ்ஜிபிடி, லிப்பிட் ப்ரொஃபைல் வித் சச் மார்பிடிட்டி வேணுமா வேண்டாமா? Mandatory. Okay, then X-ray chest and all that if you decide on interventions. Okay, surgical intervention.
Treatment, medical management.
இந்த பேஷண்ட்டுக்கு என்ன பண்ண போற? நீ எல்லா கதையும் எனக்கு சொல்ல முடியாது. இதெல்லாமே போட போறியா? What do you want to do?
Surgical.
She is 20 weeks, but she is very young. Although she is has been pregnant 6 times, okay, but only 32-year-old with no heavy menstrual bleeding, but a mass of 20 weeks. என்ன பண்ண போற?
Abdominal myomectomy.
So there can be 3% chance of coexistent endometrial carcinoma. For that you will be sampling the endometrium. Pap smear அவ போட்டிருந்தா routinely பண்ணிடுவோம். Ultrasound பண்ணிட்டு, but what you should have said is per abdomen அந்த findingலாம் முடிச்சிட்டு I should do a speculum examination. External genitalia கூட சொல்ல மாட்டீங்களா? Present பண்ணும்போது சொல்லுவீங்களா இல்லையா? External genitalia healthy. Then I should do a speculum examination, bimanual pelvic examination. அதுக்கப்புறம் probably I can come to a provisional diagnosis. As UGs, you are not expected to do. But நீங்கள் இதெல்லாம் சொன்னீங்கன்னா examiners will be thrilled. அதுக்கப்புறம் investigations போகலாம். புரியுதா? ஓகே. ஸோ இந்த பேஷண்ட் வந்து pap smear பண்ணிட்டு ஹீமோக்ளோபின் நார்மல், pap smear பண்ணிட்டோம் நார்மல், endometrial sampling normal. How will you manage this patient? Multiparous, 20 weeks, gross obesity, morbidly obese. Not sterilized.
Myomectomy.
Myomectomy. Why myomectomy?
Less than 32 years of old, ma'am.
Okay. Probably single fibroid. அல்லனா ஒரு இது she what நீ இதெல்லாம் மெடிக்கல் மேனேஜ்மெண்ட் பண்ண மாட்டியா?
பண்ணிட்டு தான் மேம் மெடிக்கல் மேனேஜ்மெண்ட் பண்ணிட்டு. Since
it is more than 12 weeks, 14 weeks, you have to do a surgical management. Okay, நம்ம வந்து மெடிக்கல் மேனேஜ்மெண்ட் வந்து என்னன்னா that will alone will not suffice. மெடிக்கல் மேனேஜ்மெண்ட் GNRH எல்லாம் கொடுக்கலாம். சப்போஸ் குழந்தை வந்து 10th எக்ஸாம் எழுதுது, அப்படியே ஊத்தின்னு இருந்தா, then medical management temporarily you can give. That will also decrease the size of the fibroid, but you have to treat her surgically later. ஏன்னா GNRH agonistலாம் temporary effect தான், and you cannot give for long. more than 6 months கொடுக்கவே முடியாது. 3 monthsக்கு மேலே add back therapy so that she does not develop hot flashes and osteoporosis. Okay, so 20 weeks sheet anchor is surgical management. Medical management ஒரு ஸ்டாப் கேப் அரேஞ்ச்மெண்ட் மாதிரி. அவள் தங்கச்சிக்கு கல்யாணம் ஆகுது, அப்போது அவள் ஆப்ரேஷன் பண்ணிப்பாளா இப்போது? நோ. தென் இன் தேட் இவெண்ட் ஒரு 2 monthsக்கு. பட் அதர்வைஸ் யூ ஹாவ் டு கோ இன் ஃபார் சர்ஜரி. ஸோ வாட் சர்ஜரி வுட் யூ வாண்ட் டு டூ?
Myomectomy.
Myomectomy. How do you want to do the myomectomy?
Abdominal type, ma'am.
Abdominal type, ma'am.
Abdominal. Open endoscopica?
Open.
It can be open. முந்தி தான்ப்பா இது இந்த மாதிரி பெரிய ஃபைப்ராய்ட்னா நம்ம வந்து எண்டோஸ்கோப்பி பண்ண முடியாது, more than 14 weeks சொன்னோம். Now sky seems to be the limit for accomplished endoscopist. But இதை வந்து மோசலேட் பண்ணி எடுக்கணும். Okay, the specimen will be very big, so you have to do a proper what is that ultrasound examination, fibroid mapping பண்ணணும். Then malignant sudden increase in size ஆனு நம்ம பார்க்கணும். Age group is not in favor. She is only 32. But still நம்ம வந்து ஒரு டியூமர் மார்க்கர்லாம் பார்த்துக்கலாம். டியூமர் மார்க்கர்ஸ் LDH isoenzyme 3, lactate dehydrogenase isoenzyme 3. வெறும் LDH கிடையாது. That is not a definitive tumor marker like CA125 for ovarian cancer. But still வேணா பண்ணலாம். But you have to do an in-bag mosylation. In-bagனா நம்ம அந்த மயோமெக்டமி பண்ணிவிட்டு அதுக்கப்புறம் அப்படியே சாம்பிள் எடுக்க முடியாது. ஏன்னா பெருசாக இருக்கு இல்லையா, யூ ஹாவ் டு மாசுலேட். நல்லா அதை வந்து இந்த கைமா பண்ணுற மாதிரி பண்ணிவிட்டு அதை வந்து பேகுக்குள்ளே வச்சு தான் பண்ணணும். ஓகே, அண்ட் தென் யூ டூ இட். ஓகே, பட் வாட் ஸோ before doing myomectomy, what will you tell her?
Informed consent will be required, ma'am, for in case of excessive hemorrhage, hysterectomy can
So
be done.
sometimes she can have torrential hemorrhage which can be uncontrollable. So in that event, probably she might have to have hysterectomy ங்கிறதையும் சொல்லணும். What are the measures you will take and what else you will counsel her prior to that?
Hemoglobin level should be restored.
அதெல்லாம் முதல்ல பார்த்துருவோம்மா, ஃபிட்டா கிட்டா கொடுப்போம். Then you should also tell fibroids வந்து மல்டிபிளா இருக்க வாய்ப்பு. Sometimes you remove அருமை வா ஆமா வா.
Hello, Madam உட்காருங்க. On behalf of our students, our faculty members, our MD, our VC, our chairman, I welcome our Madam Arunai to this general clinics. So on behalf of you, I must thank our Madam for taking care of our students like a mother, no? இல்லை வேறு யாரும் பண்ண மாட்டாங்கல்ல. Why should you take care of our students? So from, I think even before this posting started, you wanted all the people to come there, you wanted to teach. Still now, they are very happy and they have learned many things during an elective posting. Please continue to do that, Madam. I am sorry I am troubling you for nearly 1 year. I think it started about a long time back. So Emma. நீ ஸ்டூடெண்ட் தானம்மா இல்லையா? சாரி சார்.
So what is the role for NS? We talked about myomectomy. So myomectomy பண்றதுக்கு முன்னாடி what you should tell is, see, fibroids are usually, they can arise in many places. So we would have taken all these, whatever is there. A single myoma, you just remove it as such. I told you about morcellation, all these things. And through the same incision, you can have tunneling incisions and then remove all myoma. But she is only 32. She is prone for developing myomas later. So திருப்பி வந்து கேட்கக்கூடாது ஒரு 5 years கழிச்சு எனக்கு ஃபைப்ராய்ட் வந்துடுச்சே நீங்கள் ஹிஸ்டெக்டமி பண்ணியிருக்கலாமேன்னு. ஓகே, ஸோ இன் வியூ ஆஃப் அவர் ஏஜ் we are doing myomectomy. It can be an open myomectomy, it can be a laparoscopic. How do you prevent blood loss during myomectomy?
By using Boney's myomectomy clamp.
பார்த்துருக்கியா? இன்னைக்கு போய் பார்ப்பேன் நெட்டில், சரியா? ஓகே, இமேஜ் பார்த்துருக்கீங்க, அது போதும். ஓகே, and what else can you do?
Vasopressin.
Very good. You can instill vasopressin into the substance so that the bleeding is less. Okay, you can also do uterine artery prophylactically ligation பண்ணிட்டு கூட நம்ம பண்ணலாம். Okay, what is the role for NSAIDs?
To reduce the pain.
Okay, pain and bleeding. Okay, pain and bleeding. So இது வந்து temporary தான். For such a big fibroid, it is only temporary. What is the role for mifepristone?
Decreases the size of fibroid.
கத்தி பேசணும்.
Decreases the size of fibroid.
What is the dose?
10 to 25 mg.
Yeah, 10 milligram can be given or 25 milligram OD for about 3 to 6 months. But in the big fibroid, it's not useful. That is what I said. What is the role for LNG IUD?
For contraceptive use.
Not as contraceptive alone.
Bleeding.
It decreases to a certain extent. It also decreases heavy menstrual bleeding. This patient, it cannot be done because it is quite big. If any cavity more than 9 centimeters, you cannot use LNG IUD. Also, if the cavity is distorted, you cannot do it. GnRH agonist?
Decreases size of fibroid.
Okay, அது நான் என்ன சொன்னேன்? Temporary தான். And prolonged, you cannot give it more than 3 to 6 months in view of effect on, because of hot flashes and effect on the bone, osteoporosis. GnRH antagonist, the initial flare will not be there. Okay, we have aromatase inhibitors in the form of anastrozole, letrozole, all those things. Next. Okay. Suppose if she is not desiring fertility or not wishing to retain her uterus, then you will resort to hysterectomy. In the patient 32 years completed at a family nalo, we have to try for myomectomy only. But otherwise you can do. Suppose கொஞ்சம் ஒரு 45 அந்த மாதிரிலாம் இருந்ததுன்னா, we'd have directly gone in for hysterectomy. என்ன hysterectomy பண்ணுவ?
Abdominal open hysterectomy.
It can be a total abdominal hysterectomy or it can be still through endoscopy. முந்தி மாதிரி கிடையாது indications. So we have accomplished endoscopists, so we can do it only even through endoscopy. What is the role for removing the ovaries?
increased chance for ovarian carcinoma, ma'am. So we will remove.
routinely நம்ம யாராவது போய் டெஸ்டிஸ் ரிமூவ் பண்ணுறோமா டக்கு டக்குன்னு அந்த அனாலஜி ஞாபகம் வச்சுக்கணும். ஓவரியை ஜஸ்ட்டு அப்படி சாப் ஆஃப் பண்ணக்கூடாது. ஓகே, பிகாஸ் இட் ஹேஸ் லாட் ஆஃப் ஹார்மோனல் பெனிஃபிட்ஸ் விச் லாஸ்ட் லைஃப் டைம் ஃபார் ஹர். ஓகே, அவளுக்கு வந்து ஃப்யூச்சரில் கார்டியாக் டிசீஸ் வராமல் இருக்கும், லாட் ஆஃப் திங்ஸ். ஸோ இஃப் யூ திங்க் யூ வாண்ட் டு protect against ovarian cancer, you can remove the tubes alone. 4 குழந்தை இந்த வயசில் இருக்குது அவளுக்கு. So that is called as risk reducing self-injectomy. Okay, thank you. Any doubts? Kindly go and read up. அப்புறம் பார்த்துக்கலாம். Okay.